Hello and welcome from, okay, I'm just in the classroom. I'm nowhere special. I hope you're doing good and excited for today's lesson on microbes and fungi. So let's begin. So where we left off, we'll do a little review. Okay, so we talked a little bit last week about some of the different disorders that bacteria can cause. And in your discussions this week, you can explore this a little more. Choose a infection and share what you learned. And I didn't put this in the instructions, but you can certainly look on YouTube for whatever disease you find. You'll probably find somebody whose dog or cat or horse or reptile had that disorder, and it might help bring it to life for you. But bacteria can cause disorders like pink eye. This is a little bacteria that is attacking this cow's cornea. There's a condition called strangles caused by Streptococcus equi, which causes an infection of the guttural pouches. So that is not milk coming out of this horse's mouth. He's not laughing while drinking milk. That's purulent material. We can see skin infections. We can see this foal could have any number of things. He could have salmonella. He could have pneumonia from Rhodococcus equi. And it's not just these big animals, even your little friendly or not so friendly hamsters and rats and rabbits and sugar gliders, they get bacterial infections too. This guy has some sort of a gastroenteritis causing bloody diarrhea, sometimes called wet tail, although that doesn't really tell us the cause. We'll also learn about fungi. Ringworm is not fun. This lady looks like she's having fun here. I'm telling you, it's not that much fun. But she's got a black light, which is making this little lesion glow green. Fungal infections can be very nasty. I don't know if you can appreciate, but this cat's nose is all swollen and kind of misshapen. He has a kind of a fungal infection inside of his nose. This is an X-ray of a dog's chest. That is not what a chest is supposed to look like. It looks like there's like cobwebs in there or cotton candy. That's not cotton candy. That's some sort of a fungus that's branching out through his lungs. I don't even know what this thing that's outlined here is, but that cotton candy should not be there. We talked about how we live in an age that's very unique. For most of human history, if you had an infection, there were no drugs or very few drugs. A paper cut could kill you. Venereal, sexually transmitted diseases could disfigure you for life. If you had tuberculosis, the treatment was fresh air. That's it. We learned how bacteria can grow really rapidly and divide, and they can share genetics to help them fight antibiotics by either pumping antibiotics out. They have various mechanisms. Bacteria come in different shapes. Again, either sort of these rods or these little balls that we call cocci. They have, we categorize them by how they stain with this thing called gram staining. And if they stain purple, we call them gram positive. If they stain pink, we call them gram negative. The gram negatives tend to be a little more of a headache. They tend to be a little harder to predict. Thank you, Natasha. This was from her discussion, I thought this was a great little picture. We learned how different antibiotics will target different parts of the bacteria. The beta-lactams, like the penicillins, the cephalosporins, they attack the wall of the bacteria. Other antibiotics attack things inside the bacteria, DNA, proteins, enzymes, things like that. Now, I've never really found that all that helpful, but there are some cases where it's helpful. And this might seem like common sense, but this cat, I don't know if you can appreciate this, has this big swelling here with this little hole with purulent material coming out, or what we would call pus. Well, this is a cat bite abscess. Another cat bit him here, and now it's all infected, and this is full of pus. Well, you probably know we can't just say, okay, here's some antibiotics, see you later. You may already suspect that we need to drain that. We need to drain that pus out and flush it all out. And there's a reason why, because certain antibiotics work on the cell wall, and so bacteria need to be forming the cell wall in order for it to work. It's while they're forming, they're building their cell wall, is when the beta-lactam and the antibiotics can interfere and make them explode. But if the bacteria is just sitting there, then the beta-lactam can't do anything. It only works when the new cell wall is being built. And so if we flush this out, then suddenly all those bacteria can start to grow again, and then we got them. And you'll see another example later where it's helpful to know the mechanism of action. In general, I can't keep these mechanisms of action straight. So I'm going to tell you about them, but there's only a few cases that are strongly relevant. What else did we talk about? We talked about what are antimicrobials, right? Their job is to either kill or inhibit microbial microbes, either to inhibit growth or kill the little suckers. And we discussed them by looking at their target, which organisms are they really good at killing or inhibiting. We learned that some are bacteriostatic, which means they will slow the growth of the microbe. Others are bactericidal. They'll kill the bacteria. And there's nothing wrong with being bacteriostatic. It's just that you need a healthy immune system to go along with it. So that's what this figure shows. We can slow down their growth, and then your own macrophages, neutrophils, T cells, they can help kill them off. But you need a healthy immune system. If your patient had, diabetes or leukemia or cancer, you might not want to use a bacteriostatic drug. And I gave examples of bacteriostatic drugs, and really there's only one main bactericidal drug we'll talk about today. But you'll see there's a few that kind of fit in both categories. Again, our goal is to kill or to inhibit growth. In choosing an antibiotic, the veterinarian is going to want to know, well, is the bacterial infection susceptible to this antibiotic? Will this antibiotic work? And susceptible just means that the minimum inhibitory concentration is much lower than the maximum tolerated dose. That's just another way of saying that the minimum amount of drug to do the job is safe, right? The minimum amount of antibiotic to do the job, to kill the bacteria, is safe. It's not a really high amount that's close to the maximum dose. The maximum dose, beyond that, that's toxic. It's poison. So we need to make sure that the therapeutic dose is less than the maximum dose. That's all that means. We need to make sure that wherever the infection is, that the bacteria can reach that location. There are certain parts of the body that have barriers. The brain has the blood-brain barrier. The eye doesn't really have a great blood supply, so it's hard for drugs to reach the eye, drugs that are given orally or injected. The prostate is a accessory sex gland that men have. Males, I should say males have it, and it helps produce semen, but it can get infected. And it's really hard to treat. It has its own kind of weird fat layer around it. The flip side is urine. A lot of drugs are naturally excreted in urine, and so we can use that to our advantage. We can achieve really high levels of certain drugs in urine, which is good if you have a kidney infection or a bladder infection. Other factors is it okay to use this drug in this patient? For example, we learned last time how we can't really use penicillins in rabbits and other species. This week you'll learn about some other antibiotics, one in particular called clindamycin that could kill a guinea pig or a rabbit or a cow. So you'll see. Also, is it easy to give? Is it bitter? Is it once daily or 3 times daily? So those are all other factors we consider. You'll see these acronyms. GP stands for gram-positive, and that means gram-positive, usually cocci like Staphylococcus and Streptococcus, but not always. And then G- equals gram-negative. So, for example, Salmonella, Escherichia coli, Pseudomonas, and then you'll see this guy again, MRSA, methicillin-resistant Staphylococcus aureus. That's that particular type of Staphylococcus that has these receptors that the penicillins just can't bind to, so it's resistant to the penicillins and the cephalosporins. We also talked a little bit about how we are seeing drug resistance. I don't know how accurate this is, but it's telling you deaths from antimicrobial resistance in the year 2050, 10 million. So again, I don't know how trustworthy that is. We learned that most cases of resistance are really coming from over prescription of antibiotics in humans. There was a study by the CDC that said 30% of prescriptions were unnecessary. And so it's creating superbugs in the human world, but we have a role too. We have some responsibility too. Antibiotics in livestock ends up in manure, it ends up in our food. Same with our companion animals, same with fish. And all of this is applying what's called selection pressure. It's killing off certain bacteria and selecting for resistant bacteria. And you'll see that's why the Food and Drug Administration now limits, they've outlawed the use of antibiotics to promote growth, right? Because that's not really necessary. Okay. We also talked during the discussion about resistance to some parasites. Parasites, I should say, are developing resistance to dewormers. The Dirofilaria immitis, that's the heartworm. It's developing some resistance. The small strongyls, they're developing some resistance. And this just illustrates that, right? You give this horse a dewormer, you kill off these little blue worms, you leave the red worms behind, they get passed into the environment, and now that's all there is, just these resistant worms. The American Heartworm Society mentioned one particular practice in they mentioned several things, but there was one practice in particular that they said is contributing to resistance. There's lots of things contributing to resistance. People not giving the heartworm preventives consistently. Heartworms are spreading because we get urban development and more pavement, and so we get these warmer suburban, urban areas. Summers maybe getting a little longer. So there are things that are working in the heartworm's favor. This is another thing that we are doing, and we do it for a good reason, but it's not really helping. So this is called the slow kill method, and you'll find all sorts of private groups that talk about it. Veterinarians will do it. I've done it, but I guess we need to stop doing it. What does this slow kill method mean? Well, the name is not very accurate. Slow kill refers to you have a dog and they tested positive for heartworm. Okay, and so you tell the owner, well, they need, chest x-rays and blood work, and we're gonna start them on doxycycline, and you'll come back and we'll do these 3 malarsamine injections, and there's these rechecks. And by the way, the treatment plan estimate is about $1,000. Okay, well, some people cannot afford that. That malarsamine is expensive, the rechecks are expensive, but that malarsamine that's $500 or $600 right there, I think. And some people can't afford it. Well, what do? Do you just say tough luck? The slow kill method is where we say, okay, just put your dog on a heartworm preventive like an ivermectin or moxidectin or whatever, and that's it. It doesn't kill anything. Well, I'm sorry, it doesn't kill the adults. Only the malarsamine will do that. But what happens is when these adults have their babies, well, it'll kill the babies, so the dog will be less contagious. Also, if a new mosquito bites that dog and gives him the 3rd stage larva, well, the heartworm preventive will kill it. So he shouldn't be a source for new heartworm, and he shouldn't catch any new heartworm. So what's going to happen? Those heartworms living in his heart are just going to die of old age. We're going to kill their babies. I'm not going to let any new heartworms move in, but those adults will just die of old age. It can take up to 6 or 7 years, but most will die within 3 or 4 years. They're doing damage to the heart, so it's not great, but I've met many people who said, oh yeah, Dr. So-and-so had me do this slow kill method, and the heartworms are all gone, the dog looks great. But the problem is, what we were doing was every time those adult heartworms had babies and we killed them off, well, we killed off the susceptible ones. Here's this little heartworm factory just making, I don't know, thousands of baby heartworms. That's a perfect situation for us to create resistance. We give the dog a heartworm preventive, and it kills off 99% and leaves behind the 1% that are resistant. Great. And now those ones can be spread to my dog and your dog. So do you see how the slow kill method is really bad. It really contributes to resistance. So what do you do when the owner can't afford treatment? I don't have a good answer to that. Now here's some good news, right? So it's not all doom and gloom. There are some innovative ideas. And one, it came up in discussion. I'm not sure if I'm saying it correctly, but there's this concept called parasite, maybe refugia. I'm not sure, but the refugia is really the word refuge, or like a safe harbor or a safe place. And I'll explain what it means. I just wanted to read this to you. This applies not just to cows. This applies to horses. It applies to goats and sheep, but we're just going to say a few words about it so you can understand what is parasite refugia. So it's a concept, according to Dr. Ray Kaplan. It's a new approach to tackling the growing anthelmintic resistance issue. So the concept of leaving some internal parasites unexposed to a dewormer, essentially giving them refuge and thereby reducing the drug resistance selection pressure caused by the dewormer. Okay, and that's the same thing it says here. Parasite refugia includes the portion of a population of parasites not affected. So what does it mean? So the old way was, here's your herd of cows, or here's your bunch of horses, and you just deworm everybody. Every spring, every fall, everybody gets dewormed, right? So some horses have susceptible parasites and some have resistant, or what I should say is a horse may have both susceptible parasites and resistant parasites. We deworm every horse, we kill off the susceptible, leaving the resistant behind. Okay, that's the old way. That's still the way that most people do it. Okay, here's what might help. Do a fecal on every horse or groups of horses and identify the ones with a lot of worms. Deworm them. Okay, if they have a lot of worms, that's not good for them. Deworm them. If they just have a few worms, leave them be. Leave them be, because what we may find by leaving some worms behind is that this is what will be in their poop. They'll have this mixture of susceptible and resistant parasites. And who are they? Remember, a lot of these parasites that we are concerned about, they are male and female. They're nematodes. And so some of them are male, some are female. They're going to have to interbreed, and their offspring may not be resistant. If he makes some babies with her, their babies may not be resistant. So again, we're trying to keep a population of wimpy worms around. We're trying to keep a population of wimpy worms around to interbreed with the superworms. Does that make sense? And this part is a little scary. There are some problems ahead. We don't hear a lot about drug-resistant tuberculosis, but it's actually a huge deal around the world and in the US. And so we need to be vigilant in our use of antibiotics, or else we may find ourselves back in just putting people outside to treat tuberculosis or whatever. Okay, so here we go. Let's begin. That was a review. Now let's tackle some new antimicrobials. This week we'll talk about the basic mechanism of action, some key characteristics, and clinically significant disadvantages or adverse reactions for the fluoroquinolones, tetracyclines, the sulfonamides and potentiated sulfonamides, other antimicrobials like clindamycin, erythromycin, and others in that family, metronidazole, chloramphenicol, fluorphenicol, rifampicin, and some stuff you'll find in triple antibiotics. And then we'll talk about the same, but in antifungals like amphotericin B, the azoles like ketoconazole, itraconazole, fluconazole. We'll talk about griseofulvin and terbinafine. Now remember, not this week, but the following week, you will have a midterm, and that covers everything. It covers, gosh, what have we talked about? Antiparasitics, disinfectants, antimicrobials. Gosh, what else have we talked about? There's one more chapter. Anyway, the study guide has been up for several weeks, so and and the exam will be available for about a week, starting a week from today. All right, and so it'll be due May 4th. All right, there are some gruesome images. I'm sorry, but we're dealing with some really disgusting bacteria. Let's start with some of the antibiotics. So if you work at a vet clinic, if you did your internships, if you are doing an internship, have you seen any of these? If not, keep your eye open for them. Here's one called enrofloxacin. The trade name is Baytril. There's marbofloxacin, same family, that's known as Zenequin. Ciprofloxacin, we'll talk a little bit about. These are all examples of the fluoroquinolones. There's a different group. This is an eye ointment called terramycin, but the actual drug is oxytetracycline. There's tablets called minocycline and doxycycline. Those last two we use to treat our old friend Wolbachia, but they're actually used for other things as well, not just Wolbachia. So we'll talk about them. Okay, but let's start with the fluoroquinolones. And you'll hear this term used in practice called the big gun. There are certain antibiotics that are big guns. And what we mean is they are really powerful. And we try to save them. We don't just use them for simple cases. We try to use them when we need a big gun. And I try to give lots of examples here, right? There's the guy from whatever that game is, and there's Yosemite Sam, and there's a bunch of cowboys with their big guns, and whoever this person is. So, right, so do you appreciate these are cool. These are really awesome drugs. And so these are all examples of the fluoroquinolones. I put a few more on here. There's orbafloxacin. There's again, there's enrofloxacin. They make it in a much stronger concentration for cattle and swine. This one here called danofloxacin. That's just for beef cattle. So we'll talk about these. Okay. So these ones are bactericidal. We sort of secretly prefer the bactericidals, but the bacteriostatics are fine. There's nothing wrong with them. All right, how does it work? Well, it interferes with this enzyme that helps DNA stay tightly coiled. So basically, it just makes the bacteria's DNA, boom, uncoil. And this is not really a great video, but just to try to give you an idea of what it does, right? So now it's this all crazy, silly string looking DNA. So that's how it kills. And mammalian DNA coils differently, so it's not harmed by this antibiotic. Why are these called big guns? Well, for one thing, these are really effective against the gram negatives. And you may recall I said the gram negatives can be hard to predict. Some examples of gram negatives are things like Pseudomonas, Escherichia coli, also called E. coli, Salmonella, Klebsiella, and they can infect a lot of things. Probably most commonly, we see respiratory infections, we see urinary tract infections, we see skin infections, and by skin infections, I'm including the ear. You'll see dogs with Pseudomonas ear infections, and it's just a nightmare. They're really hard to treat, and we usually need a fluoroquinolone. This little creature here looks cute. I just included him because to remind you that Pseudomonas makes that biofilm. You learned about it with the disinfectants. Pseudomonas, if it gets on equipment, is very hard to disinfect because that biofilm protects it. And that's what you're kind of seeing here. I think it also makes it hard to treat when it's like in an ear infection. And I wish we had more time to talk about that. The fluoroquinolones are not very effective against streptococcus, which is interesting because streptococcus is usually a fairly wimpy and predictable bacteria, but this particular drug won't work. Also, MRSAs can pump out fluoroquinolones, and so it's not very effective against those. Now, by the way, when we choose antibiotics, it's not like we can only put a patient on one antibiotic. If we could put a patient on a fluoroquinolone and a penicillin, right? That'd be okay. We might put them on 3 different antibiotics. That's not uncommon. So it's not like we can only choose one antibiotic. But anyway, one last thing about Pseudomonas is I just wanted to show you one of those gruesome pictures of how nasty a Pseudomonas infection could be, right? There you go. There's someone's foot with that green biofilm and Pseudomonas, very resistant, very hard to kill. Okay. I'm so sorry. So again, in dogs and cats, the ones that are labeled for dogs and cats are enrofloxacin, marbofloxacin, orbofloxacin. And you'll learn these things as you reach for them. Cattle, we're a little bit limited in what we can use. And that's because we eat cattle and we drink their milk. So we don't want small amounts of fluoroquinolones to end up in our meat or our milk, ever. There is one that danofloxacin, the one that was called Draxin. Is that right? I'm sorry. No, I'm sorry, not Draxin. No, the one that was called Advocin. Sorry, Draxin is different. The danofloxacin, that one is labeled just to treat respiratory disease in beef cattle, right? Beef cattle, when they're being shipped from place to place, or when they're really young, sometimes they can get pneumonia, right? So danofloxacin, that's the one thing you can use it for. Enrofloxacin, similar. It can be used to treat respiratory disease. You can also use it in dairy cattle, but they can't be lactating, and you can use it in swine. That's it. I can't say, well, this cow has a skin infection, or this pig has an ear infection. I really want to use enrofloxacin. No, you cannot. It would be illegal. So there's no allowed extra label use. You'll have to find, or the veterinarian will have to find something, the two of you, that is labeled or can be used legally off-label to treat these other problems. Okay. There are no approved fluoroquinolones for horses, but we can use them in an extra label way. It just can't be for a horse intended for food. And believe it or not, there are horses intended to be eaten, right? Horse meat is eaten in places like France and other places in Europe, even if we find that thought a little weird. And this is showing, for example, this horse has a Pseudomonas infection of his eye. So even though there's no fluoroquinolone approved, we can use it. We can use like an orbofloxacin eye drop, for example, in his eye. Not only are they powerful against the gram negatives, but they're highly lipophilic. And you may recall that means they can pass through fat. Now, that's great. That means they can pass through things like the kidneys and the liver and the lungs. That's great. But the fact that they're lipophilic lets them reach normally hard to reach places like the prostate and the eyeballs and even the central nervous system. That's not mentioned in the book, but if you had, meningitis or prostatitis or some sort of like a deep infection of the eyeball, um, enrofloxacin or marbofloxacin might reach there. Another interesting thing is they will concentrate inside of macrophages and neutrophils, and then they get direct delivery to the sites of infection. It's like a smart missile. Um, the macrophages and neutrophils, they know where to go. They can detect inflammation, and the fluoroquinolones will kind of hitchhike in these high concentrations. So that makes them really great for things like pyoderma. And then, so that's basically it for the fluoroquinolones. I wanted to say something about this fluoroquinolone. This is probably one of the best known human antibiotics. Many people have taken ciprofloxacin for bacterial cystitis. People call it Cipro for short. The book makes it sound like that it's a reasonable choice in dogs and cats, but it's not. Every talk that I've gone to has said it's kind of a last resort. It's really cheap. That's why we might consider it. Trying to treat a 120-pound dog with enrofloxacin, we're talking hundreds of dollars. Ciprofloxacin is probably 20 bucks. It's cheap, and owners will say, "Are you trying to rip me off? Let's just use Cipro." The problem is it is unpredictable in dogs. We don't know why. It has unpredictable bioavailability, which means this dog, who you give it to this dog by mouth, and they absorb 80%. You give it to this dog by mouth, and they absorb 20%. So we use it as a last resort, and we tell owners it might not work. But we explain the risks to them. Oh, sorry, there's a few more things. Okay, so adverse effects they're important to know. One adverse effect is that if you give a fluoroquinolone to a young growing dog or horse, cartilage is still developing, right? Cartilage and bones are growing, and what can happen is a little bubble will form in that cartilage, and that could cause joint problems. So on the label, it actually says that fluoroquinolones are contraindicated in young growing, like mid-sized and small dogs, right? Contraindicated means under no circumstances can you use it. Cannot use it. Well, in reality, veterinarians have ignored that, using what we'll call relative contraindication. And what that means is, yes, it's contraindicated unless the puppy or foal's life is at stake. So I'll tell you a story. I was a brand new veterinarian, and I knew my fluoroquinolones, I knew that they were contraindicated, and we had a sick little puppy with parvo. Parvo is a virus that attacks the intestines and causes dehydration and vomiting and diarrhea, and really weakens the immune system, and it can kill dogs. And so I put the dog on a beta lactam, and then that was to kill gram positives, and then I put them on gentamicin to kill gram negatives. And then my coworker, who had just done an internship at an emergency clinic, said, "You need to put them on the fluoroquinolones. The gentamicin can, it can harm their kidneys. Put him on the fluoroquinolone. It won't upset his stomach." And I said, but or it won't harm his kidneys. And I said, but it's contraindicated in a young growing dog. And she said, "You want to save his life. It's a risk, that we need to take." And since then, I've realized that's now I understand. I've treated plenty of dogs with parvo, and knock on wood, I've never seen any problems with the fluoroquinolones. But relative contraindication means if the patient is at risk of dying, then we're going to use the fluoroquinolones. Like in this little puppy here. Isn't that cute? The other thing that can happen in cats is it can cause blindness. It does something to their retina. It's idiosyncratic, so we don't know what cat it's going to happen to. So we get a little nervous using fluoroquinolones in cats, but it can be done. The bottom line is these are really important drugs. They're important in human medicine, and so we want to save them. We don't want to use them for any old thing. We want to, you know, and we certainly do not want to use them in food animals for anything that's not on the label. And again, the label is going to mostly say respiratory infections. Okay, any questions on that? Our next group are the tetracyclines. And just like I forgot to mention this, but all the fluoroquinolones, they all ended in like oxycin, right? Marbafloxacin, enrofloxacin, right? So these will all end in cycline, right? We have oxytetracycline, doxycycline, minocycline. So you'll always recognize them by that name. Let's watch this little video of this little sick calf. And I think the owner makes some good observations. So watch what he points out and listen to his plan. He's going to mention a few antibiotics, and then we'll talk about them. The first one, one of the first ones he mentions is this one, LA200. So let's watch this.
What's going on, everybody? Everybody's having a good day, but
Oh, what'd I do? Sorry. Turn the volume up.
what's going on, everybody? Hope everybody's having a good day, but we got a little issue with the feeder steers we picked up the other day, and so I'm gonna do a little quick video and show you, I guess, symptoms of a sick cow or calf and what you can look for, and then I guess what to kind of expect. So I'm over here at the barn, and this Hereford here that I picked up, she has not been doing well. Of course, we gave her a couple shots of LA200, and then yesterday we gave her shots of NuFlow. But to look at a calf and to know it, honestly, it's kind of like a kid. If you look at a kid, you can tell when they don't feel well. Now, yesterday, she carried her head way down here, and she moped around. We literally had to like grab her and literally carry her and get her out of the way. But look how she's drawled up, sucked up in the hind corner. She's sick, but like I say, she's been vaccinated, and we gave her shots of NuFlow yesterday. If that doesn't work by Saturday, which is tomorrow, if she doesn't get better, then I'm gonna take her to the vet and get some Draxxin for her. But otherwise, she's doing much better. But like I say, I want to do just a quick video. When you look at these calves and you look at them, like I say, I mean, the way, even right now, the way she's holding her head, it's down. You know, her ears are back, which that tells me she's feeling better. Usually you'll see their ears, they'll be real droopy, and they just all around just look sad. You know, that's the best way to see it. But today her head is much higher, and actually when I put feed in the bunk, she kind of spooked away and ran away from me, which is a good thing, you know. So we're making headway, but this is just a little quick video to show you what a sick calf looks like and kind of what to look for. But if it's fetch her wash, she'll probably take off. You know, she ain't interested. But she's moving around a lot better today. Her head's higher. She actually went to the bunk and ate some feed yesterday, which she hadn't eaten in a couple days because she wasn't feeling well. But with that being said, we're going to get her fixed up. This is one of the better ones too. These Herefords that I picked up for dirt cheap. But anyway, we'll get her fixed up. I'm gonna go get her some hay real quick and see what happens. But anyway, that's something to look for. Like I say, their head, where they carry themselves. That's kind of a telltale sign for kids. But anyway, have a good day, guys. We'll see you soon.
Yeah. And so the subtitles are not right. So he said LA 200, and then he said new floor. Oh, wow, it spelled it correctly. And then if that doesn't work, he'll go to the vet to get another antibiotic called Draxin. Wow, I cannot believe it's spelling those correctly. Anyway, so
sign for kids.
And I was trying to watch her because so he thinks that she has pneumonia, and that's what I would think too. When they hold their head out like that, they're trying to just make it easier for air to get down their airways. But she's not. I can't really tell if she's breathing hard or not. But anyway, okay. So moving on. So again, he gave her some LA 200. And so we'll talk about the tetracyclines. LA 200 is one of the tetracyclines. There's older ones like LA 200, that's oxytetracycline. And then there are the newer ones like doxycycline and minocycline, which are more lipophilic. And just like we said, the fluoroquinolones are lipophilic. We mean they can penetrate into other tissues better. They can even reach the central nervous system. The other thing about being lipophilic is we can give it in a pill form. And what I mean is I'm not supposed to say pill. Okay, I can give it in an oral formulation, okay? These are bacteriostatic. They don't kill. They just interfere with protein synthesis inside bacteria. Apparently, there are many organisms that are resistant to it, so we don't use it for those. I don't know what those organisms are. I think they developed resistance a long time ago, like, I don't know, 20 or 30 years ago. But we still use the tetracyclines because they have some unique properties. And the big one is they can accumulate inside of mammalian cells where the bacteria are. So certain bacteria will actually travel inside your cells, kind of almost like a virus, and they'll hide in there. And when they're hiding inside a cell, your immune system can't find them. The tetracyclines will they're very good at accumulating within cells, and that allows them to reach and kill these little hideaways. So what kind of hideaways do we mean? Well, there are these kind of weird old bacteria called rickettsia. They're very ancient bacteria, and you know them as anaplasma. That's a tick-borne disease. You may have seen that during the discussion the other week. It hides inside of platelets. It actually harms platelets, but can also hide in platelets. Wolbachia, the book describes it as being gram-negative, but other sources describe it as being a rickettsia. So it hides in the cells of the heartworm. And there are other rickettsial organisms that we don't really see in California, but we see in like Colorado and the Rocky Mountains. We see it in the East Coast. There are spirochete diseases like Lyme disease will hide in joints. And maybe it hides in cells. I don't know, but other antibiotics won't be able to reach it, but tetracyclines will. Tetracyclines are also good at killing leptospirosis. I don't entirely know why. They're also good at killing mycoplasma and chlamydia, and these are known for causing conjunctivitis and upper respiratory infections in cats. Most upper respiratory infections in cats are viruses, and antibiotics won't work. But there are a couple of bacteria, and it's Mycoplasma and Chlamydia. And Mycoplasma is a really frustrating bacteria because it has a cell membrane but no cell wall. And so any antibiotic that would normally attack the cell wall won't work, right? Because it has no cell wall. The tetracyclines don't attack the cell wall. They go into the cell. And so for whatever reason, tetracyclines are effective against Mycoplasma. And this is showing you leptospirosis. There's these little spirochetes, and they can attack. We usually think of them as attacking the kidneys or the liver, but I guess they may also attack the eyes and the female reproductive tract. Leptospirosis, you can get it, I can get it, dogs, horses, cows. It lives in, usually they get it from standing water, ponds and lakes and rivers. But here you're seeing a cat with that upper respiratory infection from either Mycoplasma or Chlamydia, causing that really horrible conjunctivitis, that inflammation of the conjunctiva. So something else I don't really care about most of the time is how these drugs are secreted or excreted. But, you know, so there it is. The older TETs means tetracyclines, right? So there, meh, I don't care. Adverse effects we do care about. So the big adverse effect with the tetracyclines are that there's something about them that can be irritating. And if we give it in a pill form to a cat, it can cause scar tissue and inflammation of the esophagus and cause a stricture. It can cause the esophagus to get kind of narrow and form scar tissue. So that could be bad. It could get that could really harm a cat. So and again, the esophagus, that's that tube that goes from your mouth to your stomach. So with cats, we cannot dry pill a cat. Let me say that again. We cannot dry pill a cat with the tetracyclines. If we were treating a cat for Mycoplasma and we were giving her doxycycline, you can give her the pill, but then you have to give her a chaser of water afterwards. And I'll show you what I mean in a moment. Another big effect it can have is it can chelate with calcium. And that means chelate means that it binds to calcium. And what that will do is if you give it to an animal whose teeth are developing, they'll get these kind of weird yellow mottled teeth like you see here. So we try not to give this in growing animals. Apparently, the tetracyclines can also slow bone development, again, because they chelate with calcium. Now, because they're bacteriostatic, right, meaning they will inhibit the growth of bacteria, they can reduce the effectiveness of the beta-lactam antibiotics. So what do I mean by that? The beta-lactam antibiotics are the penicillins and the cephalosporins. They depend on the bacteria to be dividing, and then they will interfere with the cell wall, and the bacteria will explode. Well, what do the tetracyclines do? They stop the growth of bacteria. So that's what the tetracycline will do. That you see, it just made them all stop growing. Well, the penicillins and the cephalosporins can't do anything unless they're rapidly dividing and growing. So we don't usually combine those two drugs. We do combine, we can combine other bacteriostatic drugs and actually make them more powerful. But that particular combination of tetracyclines and beta-lactams, we try to avoid. Another adverse effect is it could kill off beneficial bacteria. You know how Elizabeth Gonzalez wrote about probiotics last week, and you know, you've got more good bacteria in you than you have cells of your body. You are like a rainforest of bacteria, and they help keep other bacteria out. Well, antibiotics, they can't always tell the good guys from the bad guys, and they might kill off the good guys, and now suddenly all these bad guys can move in. IV doxycycline can kill horses, so don't give IV doxycycline, but I've never treated a horse with doxycycline, so I don't even know if that's a thing. And then we don't ever want to use any expired drugs, but we really don't want to use expired oxytetracycline. Other expired drugs will just be less effective. But expired oxytetracycline could actually be dangerous. It decomposes into some byproduct that could harm the kidneys. So, so just something to keep in mind. Okay, so remember I said the tetracyclines can cause esophagitis in cats. So let me just show you a video about how to pill a cat. But I just have to show you this. I'm sorry. I thought it was so funny. So this was a very funny little cartoon strip I saw about how to pill your cat. I just think this is so funny. We're not going to watch the whole thing, you know, that he breaks out. So if you want to see the whole thing, go down to this website and you can see the rest of the steps on how to pill your cat. But here's how to really pill your cat. So let's watch this. And this person uses water afterwards. So it's not a bad idea to always give the cat some water afterwards. I think she shows several techniques, but we're only going to watch one. We'll see.
Each cat has got their own individual temperament, which each owner will know well. Today, I'm going to demonstrate how to administer a pill to a cat, and I'm going to demonstrate a couple of different techniques. If you're working alone, one of the easiest things to do is wrap your cat in a towel. Place the cat in the center of the towel, like so, and then bring the towel up around the cat, so you're enclosing her claws, which means she can't bring them up to scratch you. Next thing to do is to hold the cat just by the cheekbones. If you're left-handed, you should do this with your right hand. Or if you're right-handed like I am, do this with your left hand. This means you can stabilize the cat quite easily. You take the pill between your thumb and your finger, and if you gently apply pressure to the corners of the cat's mouth, this should encourage the cat to open the mouth a little. You can also use another finger just to gently open the jaws. What you want to do is place the pill as far to the back of the cat's throat as you can, but not so far to make the cat gag, as this will be quite distressing, and it may also spit the pill out. So place the pill carefully into the back of the throat, and then quickly close the cat's mouth. You can encourage the cat to swallow the pill by holding the mouth shut and rubbing the throat, or you can place a little bit of water in the mouth using a syringe or a pipette. This again will encourage the cat to swallow. If you see the cat licking her lips, that generally indicates that the pill has been swallowed.
Now the difference is, so that's fine to do with any medication. With doxycycline, you want to give at least 5 mLs of water. not just a little bit. You'd want to give quite a bit of water, just to help make sure you wash all little bits of doxycycline down. Okay, so that's it for the tetracyclines. The next group are called the sulfonamides and the potentiated sulfonamides. These all begin with the word sulfa, right? So you get, here we have, it's a little hard to see, sulfadiazine, there's sulfadimethoxine. These used to be the big guns, right? These were the fluoroquinolones before the fluoroquinolones came along, right? They were good against gram negatives. They could penetrate those hard to reach places like the central nervous system and the prostate and the eye. They're usually combined with other compounds to potentiate their effect, and potentiate means to increase. So these other compounds would be things like trimethoprim. You see that right there. Trimethoprim is one, or metoprim is another, and then that's some other antibiotic, and together they would make these into a bactericidal antibiotic. Sometimes they may be used. They may just be alone, like Albon. You see, it's used to treat bacterial pneumonia from Pasteurella. It just has the sulfa. And does that sound familiar? Albon. We learned about it a few weeks ago. It's also used to treat a protozoa known as Coccidia. Yeah. So the and this is what we learned about it a few weeks ago. The sulfas, they disrupt the enzyme that makes folic acid. Folic acid is one of the B vitamins. We all need it. Even bacteria, even the lowly protozoa need it. And so the sulfonamides are effective against protozoa like Coccidia. It's even been used to treat toxoplasma, sarcocystis, all things you learned about a few weeks ago. It's effective against gram positives and gram negatives. There's also a form that has a totally different use. They're called the enteric sulfas. These are not meant to be used as antibiotics. They're meant to stay in the gastrointestinal tract for inflammation. So if you had a patient with, colitis or enteritis, we might use this. It's called sulfasalazine, and it has an anti-inflammatory effect just inside the intestines. So its excretion is renal, and this is actually useful to know because it's kind of like the penicillins, is that we can achieve really high levels in the kidneys and the urine. And so it's important to know because we can use sulfas to treat bacterial cystitis. Okay, well, they sound great, don't they? So why are they not used more often? I'd be curious if you have an internship, if you go, if you work at a clinic, look on the shelf. Do they have any sulfa antibiotics? There's a chance that they don't have any. Well, there's two reasons why. One is there is some resistance. Okay, some resistance. Some of the gram negatives are resistant to it. But the bigger reason are the long list of adverse effects, right? There's a lot of risk, and I've seen some of these happen. So probably the big risk is this condition called keratoconjunctivitis sicca. And so kerato refers to the cornea, right? That's the clear part of your eye. That's the cornea. I misspelled that. It's conjunctivitis. Wait, let me change the spelling on that. Junk. Oh. Okay, that's the right spelling. Okay, the conjunctiva, that's the, the kind of the pink part of your eye. So those both get inflamed, and ceca means dry. Like if you've heard the word to desiccate. Anyway, ceca means dry. And so we get dry eye. And I'll show you a picture in just a moment, but by dry eye, we mean that it causes your eye, you have little glands on your eye which make mucus, other glands make water, and then there's even other glands that make oil. And so your tears, the tear film that covers your eye is actually these three layers: oil, water, and mucus. And what happens is the water part, those glands, I don't know why, but they'll stop making water and you'll get dry eye. And it's really painful and gross looking. And I'll show you a picture. Okay, we can also get a hypersensitivity. That's another word for an allergic reaction. So this dog here, it should say urticaria, not urticarial. This dog here, you can see, is breaking out in urticaria. Urticaria would also be called hives. Sometimes they'll get really itchy too. And that may happen more often in Dobermans. Possibly you can get some hepatic damage. Crystals can form, and that could damage the nephrons. That's pretty rare. We could get some blood disorders, low thrombocytes, low leukocytes. Again, that's not very common. And tallyism just means excessive drooling. Okay, but this one I've seen. My boss, who I loved, he prescribed a dog with a bladder infection, and I thought, oh boy, I've always heard that sulfas can cause dry eye, and he wasn't worried. And 3 days later, the dog showed up looking like this. So the owners were not very happy, and I think it was a permanent problem. Okay. Next antibiotic, totally different. I'm trying to keep you excited here. I know you're not really that excited. Okay. Have you ever seen dogs or cats with really bad breath, really nasty looking teeth, kind of like this? These dogs have really kind of under the gums, you can get these really nasty infections, and it's kind of a low oxygen environment down there. It's not like in the mouth, there's plenty of oxygen, but when you get into little nooks and crannies, there's not a lot of oxygen, and the bacteria there smell like sewage. Okay, so that's where this antibiotic comes in. It's called clindamycin. It belongs to this family called the lincosamides. And there are others. There's lincomycin, which is mostly used, I think, in pigs. And then there's perlamycin, which is used to treat mastitis. But the main one you're going to see is clindamycin. It's used in dogs and cats, even though it's off-label. It can be bacteriostatic or bactericidal. But the great thing about it is it's effective against these low or no oxygen bacteria. We call those anaerobes. Anaerobes means without oxygen. And we find anaerobes in dental infections, bone infections, deep skin infections. And so this is really an awesome antibiotic to treat those sorts of infections, clindamycin. But it has some adverse effects. It's in my experience, it can certainly cause some gastrointestinal upset, like vomiting and diarrhea in dogs and cats. I've never seen it cause bloody diarrhea, but again, it can kill off anaerobic bacteria, and you have a lot of good anaerobic bacteria living inside of you. You kill them off, suddenly some bad guys can bloom. And this is also why this is truly a contraindicated drug in animals who rely on fermentation. So that would be the herbivores, rabbits, hamsters, chinchillas, but even horses and ruminants. Bacteria, the good bacteria are important in you. They're even more important in the herbivores because they're actually digesting for them. And if you kill them off, they can, these really horrible bacteria called Clostridia can overtake everything. The Clostridia are already there. It's just that they just go crazy if you kill off the competition. And so it can kill. Clindamycin could kill a hamster. I've known some hamsters I would like to kill. Did I just say that? I love hamsters. Okay. Clindamycin could kill a hamster. It could kill chinchillas, which I misspelled, or guinea pigs, or things like that. So, I actually like hamsters. There's just one I'm remembering. So, moving on. Our next family of drugs you might have heard of. If you have ever heard of Z-Pak, of someone saying, oh, I got prescribed a Z-Pak. I had this really horrible sinus infection and my doctor gave me a Z-Pak. The problem is some of those, upper respiratory infections were viruses, and the Z-Pak was not helping and was probably contributing to resistance, but that's another subject. So the Z-Pak, that's a member of a group called the macrolides. There's no relation to the macrolides you learned about in the chapter on antiparasitics, right? These don't interfere. These are nothing like ivermectin, okay? So this is totally different mechanism, just the same name. Thanks a lot. These include drugs like erythromycin, azithromycin, tulathromycin, as well as a couple with names that sound totally different. So tilmycin and tylosin. So in general, if it ends with a CIN or an SIN, it might be a macrolide, but it seems to me like there might be a few others. Like you don't want to confuse these with gentamicin or what was the other one? Right. So but MYCIN, there's a good chance that it's a macrolide. Gentamicin would be an aminoglycoside. Amikacin is an aminoglycoside, but these are not those. These are macrolides. Anyway, they're bacteriostatic, yada, yada, yada. They inhibit bacterial protein synthesis. Okay. These guys are really great at respiratory bacteria that are gram positive. So these are very helpful for gram positive respiratory infections. The little cats, you know how we talked about using tetracyclines to treat mycoplasma. Well, we can also use these. So we might reach for this instead of a tetracycline. In a cat, there's a cat, if you look real closely, you see his poor little eyes, his poor little nose, they're all stuffed up and miserable. Tilmycin is labeled for cows. It's the only thing we'd ever use it in. It's also famous for killing people. So this is the only antibiotic, this is the only drug, I think, in the whole book that could kill you if you were to accidentally poke yourself with it. And there are cases of humans, they're giving antibiotics to cattle, and something slips and they jab themselves with it, and then they're dead 3 days later. It can cause a fatal cardiac damage. And so there's this little article down here about the dangers of mycotil. So potentially fatal if you got poked with it. It's an awesome drug. It's an awesome drug to treat pneumonia in cattle. Just be very careful if you're handling it. You don't want to poke a horse by mistake either, or a pig, right? You could all die, or a monkey. Okay. Other antimicrobials, we're still talking about the macrolides. Tylosin is kind of a cool one. Again, it's used for respiratory disease in cattle. It's used to treat pink eye. It's used to treat swine dysentery. It's one of the drugs labeled by the FDA for use in honeybees, and I just had to look this up, so I'll share with you what I found out. And you'll see tylosin again in a few weeks when we talk about drugs that treat GI disease. You'll see we use tylosin to treat kind of a mysterious diarrhea that we call tylosin responsive enteritis. It's like the only disease that has the drug name in it. Okay, but I had to look up, why would we use tylosin to treat honeybees? So I found this here. This is from 2005 when it was approved. It says American beekeepers will soon have a new antibiotic with which to protect their colonies from American foul brood disease. Doesn't that sound horrible? American foul brood is among the most widespread and devastating diseases of honeybees. It's caused by a bacterium that I cannot pronounce. It kills young bee larvae and transforms their remains into dark, shriveled ropes. And then these little ropes contain billions of spores that are spread by nurse bees. And so this is just showing, it just looks like goo. And the other thing is, I think the normal honeycombs are not supposed to have this weird little brown cap on it or something like that. I don't know. Something is not right here. So anyway, so tylosin can be used. And certainly in this week's discussion, if you wanted to explore honeybee diseases and tylosin, be my guest. And then remember that video we saw, the calf owner said if the calf doesn't get better, he'll take him to the vet to get a shot of Draxxin. And we talked a little bit about this in the discussion. A lot of cattle owners, they don't have to run to the vet each time to get their drugs. You know, most of our dog and cat owners, we do not send them home with injectable drugs, but our cattle and goat and pig, we write them prescriptions. They can use the prescription to buy their own LA200, their own Nuflor. You'll see what Nuflor is. They could buy their own Draxxin, except that bottle is like $700. So Draxxin is crazy expensive. But a bottle of LA200 or Nuflor, these others you'll see, even Baytril. Well, Baytril's pretty expensive too. But my point is, they don't want or need this really expensive drug. But a lot of farmers, I just write them a prescription. They get what they need for the next year. And then a year later, by law, I just have to visit their farm again and just talk with them. They know, how to treat. They can diagnose and treat their own animals. They're just not supposed to diagnose and treat someone else's animals. Only I can do that. But if they've got 500 cattle, they're not going to call me out for every sick cow. Does that make sense? They can diagnose and treat most things, probably 95% of the things. It's just those things that are kind of weird that they call me out for. Okay, anyway, so this is another one, and this is kind of crazy, right? You give one shot and it lasts for 14 days. So that's nice, especially if you got some big crazy cow you don't want to try to catch every day. It can also treat interdigital necrobacillosis. And again, that's what this looks like, where they get this horrible infection between their feet. It's really painful. And it'd be nice to just give them one shot and not have to run them into a cattle chute every day. Okay, so those are the macrolides. Next, we'll talk about, this drug is kind of in a category of its own. We learned about it when we learned about the antiprotozoals, when we learned about antiparasitics. It's metronidazole, also called Flagyl. It is bactericidal to bacteria, especially anaerobes, making it kind of like clindamycin. It's also can kill protozoans, so we use it to treat giardia. And that, you remember, is that little protozoa with the little flagellum, which I think is why metronidazole gets the name flagell. But you and I can get giardia from drinking contaminated water. Same with dogs and cats and other animals. Metronidazole, we don't know how it works, but we know that however it works well in conditions of low oxygen, and that's what makes it kind of like makes it effective against anaerobes. The really cool thing about metronidazole is it has anti-inflammatory properties. So we use it even if there's no bacterial infection. If we have a patient with really bad colitis, we'll often use metronidazole because it has a soothing effect on the colon. There are no FDA veterinary approved products, but there's nothing quite like metronidazole. So we use it off-label in horses and dogs and cats and birds and reptiles. For things like colitis, for deep puncture wounds, it's good. It can have some neurologic signs, usually if we're using high doses. So ataxia would be kind of stumbling. Nystagmus is this sort of weird eye movement. I can't really demonstrate it, but the eye kind of goes fast one way and slow another. Tremors, in really rare cases, a seizure, but that would be rare. So if it is causing, ataxia or nystagmus, we just stop it and try something else. And usually within hours or days, those signs go away. One important thing we mentioned a few weeks ago is this stuff tastes horrible. It is so bitter. And so if a dog or a cat, if they bite into it, they are just going to start drooling like crazy. So we sometimes make this in a liquid form to try to disguise this really horrible bitter taste. Our next antibiotic are, they're called chloramphenicol and fluorphenicol. And these are bacteriostatic. Again, who cares? That's how they work. Chloramphenicol, I have never, ever seen anybody use. I work at one place where I see it on the shelf. I don't know what they use it for. It does have excellent penetration of central nervous system and the eye and the prostate. It's effective against rickettsial organisms. It may be making a little bit of a comeback. The main reason why it's not used is if you get it on your hands, or in your body, it can cause what's called aplastic anemia. Now, anemia usually just means low red blood cell numbers. Okay, aplastic anemia means low red blood cells, low white blood cells, low platelets, low everything. That could be deadly, right? This just shows you normal bone marrow making red blood cells and white blood cells and platelets. Yeah, but here's aplastic anemia, right? The bone marrow is not making anything. There's too few blood cells. So actually, those were white blood cells, and I can't see any platelets there. So anyway, and that's why you can never, ever, for any reason, use chloramphenicol in a food animal, right? Because if a small amount of chloramphenicol was in the milk or the meat, and we ate it, we could get aplastic anemia. The one that is still used, and this was the gentleman was calling it Nuflo. Maybe that was just his way of saying new floor. But this one is still around. We use this in cattle. As you're seeing, most of these cattle ones, they're to treat respiratory diseases. Cattle are really prone to respiratory disease. Horses are really prone to colic and laminitis, but cows are really prone to pneumonias. Sorry, I don't know when that turned off. Okay, so the so that's what this one's used for. There's no risk of aplastic anemia. It lasts a while, and I put the ad here just, you know, whatever helps you remember what these drugs are and what they're used for. So it's just an advertisement that just mentions Nuflor. Okay, just a couple more antimicrobials. These are ones but this one I don't have any experience with. It's called rifampin. It can be bacteriostatic or cidal. So it's really just used for one thing. It's a particular kind of pneumonia that foals get caused by Rhodococcus equi. Not fools, foals. Anyway, so, and it has a kind of unusual adverse effect. It can make the urine and tears and sweat and saliva look orange or red. And that is something you want to tell the client so they don't freak out. I couldn't find a good picture. This is some sort of like a Gatorade ad. But anyway, so that's just showing this guy with orange sweat, and then there's that orange urine the patient could have. The client might think it's bloody, but it's just the rifampin making it orange. And then our final antibiotic is bacitracin, and is really only significant because it shows up in topical medication. So if you look at a tube of triple antibiotic, you'll see it there. There's bacitracin. This is an ophthalmic ointment to treat an infected cornea ulcer. And there it is again, bacitracin. There's neomycin, so that's an aminoglycoside, just like amikacin and gentamicin. But you see, it ends in that MYCIN. It is not in the same family as erythromycin or azithromycin. That's kind of annoying. And polymyxin is just something that's effective against Pseudomonas. So these are actually pretty powerful little antibiotics you have in your bathroom drawer. Okay, I still haven't made a Quizlet for last week's class, so I need to do that. Okay, but we'll try to do that. So you could certainly stop here if you wanted to and review, and then we'll continue. In fact, I'm gonna go ahead and continue. So it'll be one big file, okay? So we're just gonna continue, but you can pause. Okay, because we only have a few more drugs left. And if you only see one Quizlet, that's because I thought maybe we'll just do the one. But you can look on Canvas, and I should have these Quizlets up for you just to review. Okay, all right, that's it for bacteria. Let's talk about a fungus. So the fungi, which I'm not sure how you say that, fungi, these are very different from bacteria. Bacteria, remember, they can be little rods or little cocci, these little balls. Fungi are very different. It's a huge family of totally different organisms. Most are not harmful, right? There's fungi everywhere. Most of them are harmless. Some are probably helpful. Remember that penicillin was discovered from a fungus, but some of them do cause diseases. They look very different under the microscope. The most common fungus, or one of the most common that you'll work with, is one of the fungi that causes ringworm. I'm just mentioning one here, Microsporum canis, but there are others. Again, this little cat has that little bald spot on his head. It may look like nothing, but it could actually be a fungus. And I'll show you a video of someone using the black light to make it glow. And this is what Microsporum canis would look like. This kind of weird, almost like a plant. Well, it is like a plant. This is a more serious fungal infection called cryptococcus. It's in this cat's nose. It's causing swelling. It's eating away at his bone. And if you were to look at a sample of his nasal discharge, you'd see all these little fungi here. Another kind of evil fungus that can destroy the nasal passages is aspergillus. And here it has this kind of, looks like almost like coral, this branching appearance. And another really bad one that gets into, it can get into the lungs. It's called histoplasma. Another one is blastomyces. We don't really have those out here in California. We have one called coccidiomycosis that I should add to the discussion as an option. It's called valley fever. We have that out in the western United States. These histo and blasto, those are more east of the Mississippi, but they can cause a fungal pneumonia. And again, there's that cotton candy appearance. That's horrible. And then you can kind of see this. It just almost looks like this weird cluster, like a raspberry. So I tried to make a comparison of a fungal infection versus a bacterial infection. So I just wrote, funguses, they tend to be more plant-like, they're larger, they grow more slowly. They tend to have these sort of thick walls, and so that even if a macrophage or a neutrophil eats them, I think they can be hard to kill. They take longer to treat. Bacteria, on the other hand, you know, they tend to grow faster. They don't necessarily have some thick wall that makes it hard to destroy them. We use antifungals to treat a fungus, and some examples would be ringworm, and I'm using, these are some human examples, thrush in children, yeast infections like jock itch or athlete's foot. In animals, otitis externa from the yeast known as Malassezia pachydermatitis. Yeasts are a type of fungus. But for bacteria, examples would be Staphylococcus aureus, Escherichia coli, Wolbachia, Mycoplasma, Chlamydia, Salmonella. You know, all the different ones we talked about. Okay. The antifungal drugs, so these are drugs that target either a superficial mycosis. Mycosis means a fungal infection. And so the most well-known superficial mycosis would be ringworm. And then others will treat what are called deep or a systemic mycosis, right? So that would be some infection kind of within the body, like that fungal pneumonia, even this nasal fungus would probably be considered deep. And some of the drugs need special handling. Most of the newer ones are not so bad, but you'll see that some of them are teratogenic, and that means they could be teratogenic to you if you were pregnant. The subtitles are getting that wrong. Teratogenic is that word that means it can harm a developing fetus. So Dr. Martinez is going to demonstrate a case of ringworm, and he will also talk about using a drug called lime sulfur. It's really more of a chemical dip that's actually really helpful, but he gives a nice overview. He says a few things that I disagree with, but okay, I'll just let him have his say. He says that wheat allergies are a big problem in cats, and I think food allergies are a big problem, but I don't think wheat is a major allergen, but who knows, you know, different opinions. So, but we'll just watch his video.
Well, this is our hospital cat, Squeak. Squeak has large areas of hair loss, which we've accentuated with a good clipping. And Squeak also has he had circular patches. She had circular patches of hair gone in her face and around her ears. What can cause this hair loss? Well, in cats, it can be, a lot of times it can be flea allergies. So you look for fleas clawing around the face, things darting around, sometimes you'll see here and here. Could be food allergies, cats that eat wheat products, gluten products, can get a reaction in the face. Or it can be ringworm. Ringworm is a fungus that they get from other cats. Fleas can transmit it from cat to cat, and other cats can transmit it to each other. And it grows on the hair shafts, and then the hair comes off, and you get bald areas. And it can be contagious from cat to cat, and people can get it. There's a couple different kinds of ringworm. The one that glows is Microsporum canis. And I'll show you how it looks when I turn off the light. We're going to take our black light and we shine it right on the ringworm area, and we see if we can see these places that glow. So you'll see in that area, you'll see right here, there's a really nice glowing ringworm area. And over here, there is too. There's a few, so you can see down in there. So that's what we look for. It all doesn't glow is the problem. Sometimes we need to culture it. And then sometimes the cultures aren't even that good, but you can really see it here. So I thought you'd really enjoy seeing the light show that Squeak's providing us with. Healthy skin in cats and in dogs will let the ringworm grow. And in that unhealthy skin, it can be unhealthy because of lack of oils or allergens. So I want to address that too. Long-haired cats sometimes, like in cavities, totally shaved and dipped once a week. And it could take months. Sometimes it takes up to 90 days, 4 months in order of constant treatment to get rid of the ringworm. This is a drug that we don't use very often. It's called itraconazole, because most ringworm actually goes away on its own. We treat it with a shampoo or a lotion for a while. Within a month, it's gone. But we're going to use, since our hospital cat naturally has a case that we just can't get rid of, we're going to have to use this itraconazole for a few months to see if we can get rid of it. Get rid of this unsightly balding cat. Nothing's wrong with balding. I'm balding, but it's just a cat with all this hair loss. It's not good. Just to recap, circular hairless areas on a cat can be ringworm, can be fleas, could be food allergy, could be mange mites. All these could be checked out by your veterinarian. These circular patches sometimes go away on their own with something as simple as miconazole ointment and a shampoo. Others are really resistant and take lime sulfur dips and possibly an antifungal to get rid of them. Remember, ringworm is not a worm, but it's a sprouting little flower that grows on the hair shafts and eats into the skin and causes the hair to fall off. And can be quite resistant. If a multi-cat household, all the cats could be needed to be dipped once a week for a while to get rid of it. These patches can also be a mange mite called Demodex cati, and your vet would have to scrape to see if that's the case. And lime sulfur dip is also good for that. Remember, food allergies in cats, like wheat allergies, can cause cats to have all these ringworm and mite infections because the wheat makes the skin break out and lets these get in. Better cat foods with no grain and more oils might help the skin be a little healthier and might ward off some of these infections. And if you
Okay, the grain-free diets could cause heart problems. Okay, that wellness though that is an awfully good food. Okay, but Purina makes some good foods too. Okay, so like he said, it's one of the most common cause of ringworm is Microsporum canis. There are others. It's not a worm; it's a fungus. And the sort of correct term, the medical term for ringworm would be dermatophytosis. Dermatophyte, referring to a skin fungus. They can get it from animal to animal. They can get it even just from outdoors, being around wood piles and dirt. The fungus will colonize the shaft of hair. So here's a hair, and there's the shaft, and so the fungus kind of gets in here and it just makes the hair fall out. To diagnose it, we can sometimes use that black light, but it's still, it's not perfect. Some will not fluoresce. So sometimes we pluck hairs and look under the microscope. Some we really want to culture. Culturing is really the best. And then, and it's kind of hard to say when to treat or not. If it's just one cat with a simple little bald spot, well, we might do nothing. We might have the owner put an ointment on. If it was like this cat and there was multiple cats in the house, or if the owner had some health issues, we might be more aggressive and do, you know, an oral antifungal and some topicals. So we'll talk about that. The drugs we'll talk about, there's the intravenous antifungal. There's only one that's called amphotericin B, and so that's really for some of these deep fungal problems. There are various oral antifungals. There's these azoles we'll talk about, griseofulvin and terbinafine. These can be used for deep or superficial mycoses. And then there's the topical antifungals. These could be shampoos or ointments, usually with the azoles. Terbinafine comes as a topical. And then we won't say much about it. I wish we had time, but lime sulfur, that's what this cat at this rescue in New York City is being dipped in. It's perfectly safe. It kind of stains everything yellow though. So make sure you're wearing gloves and you're not wearing, you know, jewelry. And the cat will eventually not be yellow, but again, though, that's for dermatophytosis. Okay, so the first antifungal we'll talk about is amphotericin B. I've only used this a couple of times. I don't have a lot of experience with it. All of the antifungals are kind of like the penicillins and the cephalosporins in that they disrupt the cell membrane of the fungus. They disrupt this component called ergosterol. And I'll show you a picture. So that's how amphotericin B works. It can only be given IV. There is no oral form. So it's given IV and it starts killing right away within a couple of hours. So it would be used for blastomycosis, histoplasma. I think there are some cases where the fungus may be resistant to it, but this is just kind of an overview. It can be damaging to the kidneys. I guess it can constrict a blood vessel or constrict the blood supply to the kidneys. But the newer forms are in what's called a liposomal form. So it's in this kind of little lipid capsule, and that's much safer. And this is just showing a dog who's got that aspergillus, and it's causing like his skin just kind of this fissures and these deep crevices of infection on and around his muzzle. And this is just showing you, this is the cell wall of a fungus. It has all these weird extra things. There's chitin, right? The chitin that we learned about that makes cockroaches go crunch when you step on them. Chitin and these things called manoproteins. Anyway, there's this little thing called ergosterol that's part of the cell wall. And that's what all of the, I shouldn't say all of the antifungal drugs. Amphotericin B will mess with it, and the azoles will mess with it. Okay, these are probably the main ones you're going to use. These are actually really awesome, and they're used for some different things. The azoles, they all end in azole. That's great. Again, metronidazole is not an azole. So just because it ends in azole, just make sure you got it straight. Most things that end with azole will be an antifungal. Again, they disrupt that ergosterol. They actually disrupt the production of it. These guys take a while to start working. They may take 5 days to start working. So that's a lot slower than amphotericin B. Again, they can be used for deep fungal problems or superficial fungal problems. I should say mycoses, okay, deep mycoses or superficial mycoses. The oldest and the first one is ketoconazole. That was the prototype azole. Again, um, all of these are primarily oral, although some of them are made in a shampoo or a topical form. Um, Ketoconazole could have some teratogenic effects. So if you were pregnant, you might not want to dispense this. You might want someone else to work with it. It interferes with cytochrome P450. Now that's the little cookie monster enzyme that we think of as destroying drugs, and it is. It actually does something unexpected. It helps produce testosterone. It actually converts progesterone into testosterone. I've never really understood that. But why would that matter? Well, because if you give a patient ketoconazole, the ketoconazole will reduce production of testosterone. And if this is your patient, some breeding champion, maybe he has a ear infection, or maybe he has ringworm. If the owner is trying to use him to get a dog pregnant, the veterinarian cannot use ketoconazole because it could lower his testosterone, and that would lower his sperm counts. Ketoconazole can have an idiosyncratic hepatotoxicity. We learned about that also, like with phenobarbital. It can't be predicted. It's pretty rare, but it could happen. We also monitor the liver enzymes. That's, even though it can't be predicted, we do anyway, just because it gives us peace of mind. It's normal for some of the liver enzymes to change. Just like you learned with prednisone and phenobarbital, we'll see certain liver values change. It doesn't mean there's anything wrong. And that's also the case with ketoconazole. If it's a small change and the animal seems fine, otherwise, we're not going to worry about it. If the animal's acting sick, they're losing weight, there's diarrhea and vomiting, then we might worry. The other azoles, there's itraconazole. That's a little more potent. It has less side effects. You're probably more likely to work with that. Fluconazole is also more potent. It also has less chance of harming the liver. So this is probably one of the main ones that you'll use. These last two are used in topical forms. There is a nasal infusion that we could use for aspergillus. So this dog is under anesthesia, and he's got all these basically things plugging his nose up, and then they're soaking his nasal passages with clotrimazole to kill that deep mycoses caused by aspergillus. All right, completely different antifungal called griseofulvin. This is what we used to use before the terbinafine and before the azoles. You might still see it. Again, it's used to treat dermatophytosis, in other words, ringworm. This one actually interferes with the microtubules of the fungus so that it can't, it can't replicate. It can harm the fetus of a cat. If a cat is pregnant, we don't want to use griseofulvin, and it could cause vomiting and diarrhea. Terbinafine is another. It's now being used to treat ringworm, and so you'll see a lot of veterinarians prescribing terbinafine. Okay, again, who cares? It damages their cell membranes. Great. And you'll also see this at the drugstore in the form known as Lamisil to treat, athlete's foot and things like that. And so I suppose you could use a little bit of this on a dog or cat's skin. but we'll often use the oral form. Okay, that is it for antimicrobials. Again, I'll try to create at least 1 or 2 Quizlets for you. And if you have any questions, contact me. And then, again, dig a little deeper this week in your discussions. You know, get to know a particular antibiotic or antibiotics and some bacterial or fungal infection. Okay, you take care.